Hi guys, thanks for joining me. Today I want to talk about hyperthyroidism. Luke is sleeping here next to me, so I figured I would record a video. Hyperthyroidism is excessive thyroid in the body or too much thyroid in the body. We can see it in both cats and dogs, but it's more common in cats. We do tend to see it in dogs, and unfortunately, it's often due to cancer. Whereas in cats, it's often due to a benign disease process that can be treated fairly easily. It can be a bit expensive, but we again do see it more commonly in cats. So in dogs, when they get it, usually what's happening is they're coming in with symptoms of high thyroid. Not always, sometimes it's picked up because a mass is felt in the neck region. Typically for these patients, if they do have a cancerous tumor in the region of the thyroid gland in their neck, and it's producing thyroid hormone, they tend to have a more severe disease process. And so often for those dogs, we're talking about surgery or radiation therapy, some sort of treatment for the cancer. And depending on really the grade of disease determines, how aggressive it can be. I'm going to focus more on cats because, again, we see that more commonly and it's more manageable. So in cats, hyperthyroidism, again, is an overactive thyroid gland. And often that happens from a benign nodule on the thyroid gland itself. Sometimes this nodule can actually be palpated in the neck. Again, it's usually right by the voice box, so in the upper portion of the neck. Typically, these cats come in for signs of an overactive metabolism. So in a lot of cases, they are, either really skinny or rapidly losing weight. They can be ravenously hungry. Rarely their appetite can actually be diminished, but most of the time they're super, super hungry. They also can come in with gastrointestinal symptoms, so vomiting or diarrhea. Often that'll prompt them to be evaluated by a vet. And whether or not the thyroid gland can be palpated, often the thyroid blood test is something that's done to look for it. Other symptoms for hyperthyroidism, cats also can get a thyroid storm where basically they can have a personality change. They can get a lot more grumpy, have a short fuse. They also can get really, really stressed. They can have a rapid heart rate. And in some cases, with how hard the heart is working, because of the metabolism, they can actually give themselves heart disease. So the heart muscle can thicken and not really relax easily and not allow the heart to really fill with blood. And so we call that hypertrophic cardiomyopathy. They also can have high blood pressure. So all of these things can be symptoms of hyperthyroidism. They also can have some changes on their blood work where basically they can have elevated liver values, and again, that can prompt an assessment of the thyroid hormone. So all of those things will cause us to want to take a look at the thyroid. Now, luckily with this disease, unlike the low thyroid or hypothyroidism, just doing a total thyroid, that picks up the majority of pets with hyperthyroidism. Not always. Sometimes these kitties can have sort of a borderline high total thyroid, and in those situations we want to do a free thyroid, a free T4, to actually look at the active fraction to see if that's elevated. So those would be things that we want to do to get the diagnosis. Now, when it comes to treatment, there's kind of two main arms of treatment for cats. One is giving medication. So there's a medication called methimazole that actually blocks the incorporation of iodine into making the thyroid hormone. So it basically blocks production of thyroid hormone. Now it's nice to be able to, medicate and treat it, but the problem is some cats can actually have allergic reactions to the medication. So if they start treatment and all of a sudden they get really itchy, they're having severe facial itchiness, they have to come off the drug right away. It's almost akin to a person having a allergic reaction to medication or food, so we have to take them off of that. We start low usually, and then we can work our way up to get a thyroid level in the normal range. Another treatment option that rarely I see work, but I think if a kitty had a borderline high thyroid, then there's actually a diet called YD that does the same thing, where it basically blocks production of thyroid hormone. The last treatment, because usually we don't do surgery for these guys anymore, so the last treatment is actually pretty interesting. It's called I-131 therapy, or radioactive iodide therapy. And basically what happens is these kitties are given radioactive iodine as an injection, and that iodine is going to be concentrated in the overactive thyroid tissue and actually kill off the overactive tissue. So these guys actually have to be off any treatment for their hyperthyroidism, so that their overactive gland is overactive enough to actually take the radioactive therapy in, and then they have to basically be isolated in a facility that is equipped to handle radioactive therapy, and they're kept in kind of isolation until their radioactivity subsides enough that they can go home and don't pose a risk to anyone else they come in contact with. What's nice about this treatment is it's often a one and done sort of treatment, so although it's a bit expensive, it actually can kind of cure these guys. This treatment can also be used for cancer in the rare cases that cancer is the cause of this. And so it's kind of cool to have this treatment that works and theoretically cures them. But not everyone wants to have their cat in isolation and away from home for multiple days in a row, or in some cases they're not stable enough to have the treatment. So some of the criteria prior to having treatment is that they've been on methimazole, so the oral medication designed to lower their thyroid hormone, because what we want to make sure is that there's no consequence of having a normal thyroid. So a lot of cats with hyperthyroidism will actually have kidney disease or kidney insufficiency, and having a high thyroid level actually increases blood flow to the kidneys, and so it can often mask underlying kidney disease. And so we want to make sure that once their thyroid hormone is normal, that their kidneys are able to handle it. Because if you give I-131 therapy and you cure them and they have underlying kidney disease, then basically you've treated one problem and uncovered another. And so we want to make sure that with a normal thyroid level, everything else is okay. And so usually these patients are on meds first. They kind of go through that, make sure that things are working the way you want it to, and then they're taken off the medications, and then about a week or two later they get their I-131 therapy. It also would be an option for pets that don't tolerate methimazole. Tommy's, you hear that noise? That's Tommy dreaming and barking and growling. It's adorable. So yeah, we want to make sure again that before they get this treatment that we've done everything we can to make sure there's no other issues going on.